A medical study done at Helen DeVos Children's Hospital suggests that minority children are more likely to die as a result of cancer. Our Angeline McCall spoke with one of the authors of that study.
These pictures show childhood cancer patients, or as I like to say, fighters. Cancer is one thing they have in common, but their race, backgrounds, families, and histories are all different. Dr. Rajasekaran has dedicated his career to treating some of the sickest who show up to the hospital.
So definitely a big interest in taking care of kids who have cancer, especially when they end up in the ICU.
Throughout his years, he noticed minority children dying more often than their white counterparts as a direct result of cancer or other conditions caused by the disease. He, along with scientist Mara Lamenis-Lawrence, set out to understand why, resulting in this study, compiling data from 12,000 patients over the course of about 10 years.
So what that allowed us to do was to look at patients with cancer, children with cancer, being admitted in ICUs across the country, and to see how they were doing in those ICUs. Did they get out of the ICU? Did they end up, passing away in the ICU? That kind of information. It's purely epidemiologic.
The findings are alarming, with a 34.9% difference in mortality rates between African American children and Caucasian children, and 28.6% between Hispanic kids.
If you live in the real world, then you realize that it's probably not genetic. It's probably had to do with access. It probably has to do with a whole bunch of other things that these kids were not getting as the same as other kids.
Not to mention, when they do get to the ICU, the study found these minority children are already at a disadvantage.
But that's one thing for sure. These patients are coming to the ICU a lot sicker.
The findings reiterate what we know. Racial disparities exist in the healthcare system, something we're seeing with COVID as well, and something we as a society, according to Dr. Rajasekaran, should address.
And needing more care. I think one of the mistakes we make as a society is that if you don't figure these things out in the early phase, we end up paying a lot more. Because if you think about these kids coming to the ICU and having a longer stay in the ICU or passing away in the ICU days cost a lot of money, So if we could do better, if we could approach care in a better way and take care of these patients early on, then it really helps that you actually end up saving more money at the end of the day. And this is what
Angeline McCall, Fox 17 News.
And the study also looked at regional disparities, finding that children in the south and western part of the country especially were much more likely to die than children with the same condition in the Northeast or Midwest.